Today, I finally rise on the floor of this House on a bill that is focused on the cost of prescription drugs. And that bill, Madam Speaker, is House Bill 4005, a bill that focuses on prescription drug price transparency. In my first term, I was hazed by the chair of the House Healthcare Committee, and I hope he does not think I'm impugning him by saying that. And that hazing consisted of chairing a work group on prescription drugs and attempting to figure out if we could do something about high-cost medications and making them more affordable for Oregonians. That work group met for almost 18 months. Reps Lively and Kennemer were part of it as well, along with a lot of other stakeholders in our state on this topic. And coming out of that work group, I introduced House Bill 2387 in our 2017 session, with the goal of lowering prescription drug prices and doing it in a way that made all segments of the healthcare industry that contribute to the cost of medications, as they say, have some skin in the game. It was an aggressive bill, it was not a consensus product, and it did not end up passing for a lot of reasons. I learned a lot from that experience, running that work group and trying to pass that bill. So this session, I'm before you today with House Bill 4005, a bill that asks us to take a first step in dealing with drug costs. It asks a drug manufacturer to explain why they're raising their price so much. Now, more specifically, House Bill 4005 will create a new program under the Department of Consumer and Business Services that would monitor drug price increases for prescription drugs. Starting in July of 2019, if a drug that costs $100 or more for a 1-month supply increases its price by more than 10% in a calendar year, the manufacturer of that drug must submit to the Department of Consumer and Business Services a report that explains the cost increase. And that report needs to include the following things: the price of the drug, as well as the percentage increase over the calendar year, the length of time the prescription drug has been on the market, the name of any generic version of the drug on the market, the research and development costs that were paid for using public funds, the factors that contributed to the price increase, the direct costs the manufacturer incurred in marketing and distributing that drug, any cost incurred in ongoing safety research, the total sales revenue for the drug in the previous calendar year, the manufacturer's attributable profit to that drug for the calendar year, the introductory price for that drug at the time of the FDA approval, as well as the net yearly increase in price over the last 5 years, and the 10 highest prices paid for that prescription drug in any other country other than the United States during that previous calendar year. The bill also asks insurance companies to submit their own separate reports. Insurers must provide to the Department of Consumer and Business Services the following information: the top 25 most frequently prescribed drugs on their plan, the top 25 most costly drugs as a portion of annual spending, the top 25 drugs that cause the greatest increase in plan spending, and the impacts these costs are having on their premiums and their rates. No later than December 15th of each year, the department will compile this information and report it to this body. The report will also include recommendations for legislative changes that can reduce the cost of prescription drugs for consumers. DCBS will also post this information publicly on a website, with the exception of information that is considered a trade secret under ORS 192.345. If DCBS withholds information from public discourse, the department must submit a report of its own in justifying that decision. Funding for this program will be derived from fees, other funds, not general funds, to be paid to DCBS by the drug manufacturers. Such fees will be set via rulemaking. DCBS projects the cost of complying with the provisions of this bill to be approximately $425,000 for the biennium for 3 positions, 1.5 FTE, and for the remainder of 2017-2019 biennium, and $577,000 for 3 positions, 3 FTE, for the next biennium, 2019-2021. DCBS is also granted the authority to charge a penalty fee if the manufacturers fail to provide a report or are found to have deliberately omitted information. The final thing this bill does is create a task force that will report to this legislature ideas and approaches for cost-effective and enforceable solutions for exposing the cost factors that impact prescription drug prices for consumers. The goal is to eventually create transparency across the entire supply chain in addition to the manufacturers and the price that they set. This first report on drugs that have increased their price and why will not come out until July of 2019 to give that task force a chance to do its work and perhaps come up with additional options. That's what the bill does, Madam Speaker. That's all the bill does. And, you know, this bill's had its critics, mainly the pharmaceutical industry. They've said that this bill will do nothing to help consumers afford their medications. But for a bill that's going to do nothing, it's been fought over pretty significantly. Yet again, there's another ad in the Oregonian opposing this bill in my hometown newspaper. House Bill 4005 will help our state take a first step, a step we need to take to begin to get at the fastest growing expense we have in healthcare today, prescription drugs. And with that, Madam Speaker, I believe my co-carrier and the chief co-sponsor in this body, the good representative from Oregon's wine country, has a few additional comments that he would like to add about the bill. At the beginning of the 2017 session, KGW, a TV station in Portland, they did a study. They compiled a list of 100 drugs that have increased their price more than 70% or greater over a 4-year period from the years 2012 to 2016. Tetracycline, it's an antibiotic, a generic. It increased from 7 cents a dose to $8.54 a dose. That's a 12,000% increase. Ducelix, I'm not even sure I'm saying that right. It's a brand name drug that's taken for arthritis. It increased from $1.73 a dose to $22.02 a dose. That's a 1,171% increase. Humira, which is also a brand name drug, used to treat arthritis, it increased from $1,006 to $1,990 a dose, a 98% increase. And there are 97 other drugs on that list, all with similar stories. Colleagues, we have to do something about this. Drug costs are skyrocketing, and we don't know why. And yeah, this bill is not going to solve every problem of prescription drug costs that we're facing all on its own, but it is a good start. And what's wrong with a good start? I know some of you have heard concerns about how this bill would hamper research and development by smaller firms. I want to make clear that this bill will not impact those firms. The bill targets manufacturers who are selling these products, not the research firms that sell their new patents to larger, multinational, billion-dollar corporations like Pfizer, Novartis, Merck, Gilead, and Eli Lilly. Our state's laws already provide for protection for trade secrets, and this bill is not changing that. The bill does not set a price for drugs. I sometimes wish it would. A manufacturer can continue to charge as much as they want for a drug to cure cancer or any other ailment or disease that plagues humankind. It only impacts new drugs brought onto the market that cost more than $100 per prescription, and drugs that have been on the market that cost more than $100 for a prescription where the price goes up higher than 10% over the course of a year. Madam Speaker, I also want to put this on the record. The task force isn't meant to examine the merits of the base bill. Transparency for pharmaceutical manufacturers has been examined and vetted by work groups over the course of several years, and it's a necessary first step. The task force will be looking at expanding transparency to other areas of the distribution chain and see if that will help us get a handle on costs and whether there are other ideas to consider in relation to drug pricing. I ask you, colleagues, shouldn't we know what's going on with something like medicine and its pricing, something so vital for human health? Madam Speaker, I ask you and my colleagues to pass House Bill 4005 because at the end of the day, this problem starts with the price.